What am I doing? What am I doing? Oh yeah, that's right, I'm doing me. I'm doing me. I'm living life right now, man.
Yo, what's up everybody? It's just JAK Crohnsboy from Crohnsboy.com. Just doing a little piece talking about joint pain, back pain, arthritis, and stuff like that in regards to, I guess, pretty much anybody with an inflammatory bowel disease knows what I'm talking about in regards to suffering with joint pains and back pain, and whether you want to call it arthritis, whatever you want to call it. Suffering from pain, let's just put it that way. You know, and the reason I want to talk about this is I notice a lot of people that seem to email me and message me mention these pains, and I don't think on my site that I've dramatically went over like my experience with these pains and some other people's experience that I've spoke with. So I just wanted to touch base on it, you know, because it seems to be a pretty common symptom of IBD. You know, I remember in the beginning when I was first diagnosed with Crohn's and colitis, and even a few years before that, because I probably had Crohn's for quite a few years before I was even diagnosed. But I remember I used to suffer from really, really bad lower back pain and joint pain, and the joint pain was really bad in my knees. Like, I could barely stand in a spot for more than a minute before I literally had to sit down because it was so bad. You know, so that was pretty excessive, and I'm sure anybody that has an IBD knows exactly what I'm talking about. But the great news is when I started to heal from, when I started to do various things like diet, lifestyle changes, you know, supplements, that sort of thing, all the stuff that I mentioned, my inflammatory bowel disease, but not just my protocol, a lot of protocols that sort of utilize a lot of the fundamentals that I did. You know, when I started to heal, I noticed that a lot of these, pretty much the back pain and the joint pain, you know what, it literally started to dissipate and go away. Within probably, I'd say between 8 and 12 months, I was no longer experiencing this pain. You know what I mean? I went from getting really severe pain to barely feeling any pain at all. You know? So, just for anybody that's suffering through these pains right now that thinks that they're pretty unbearable, I'm telling you, when you start to heal your body, you'll notice a lot of things drop in severity. You know what I mean? You just got to keep that in mind, because as you heal, a lot of these little kinks get worked out of the way. You know what I mean? It could take a few years for everything to go away, but you'll notice little things that, you know, slowly going away and going away. You know, another thing is when I started to search the joint pain and the, you know, whether it be joint pain, swelling of the hands, or, you know, your sore back and all these things. You know, a lot of people with IBDs and almost any autoimmune disease seem to suffer from this. You know, and what I noticed is I started to search protocols to heal, like, pretty much like an arthritis diet and that sort of thing. And all these things that I seemed to find, all the fundamentals of every single, I'd say the majority of every single protocol that I could find to help with arthritis was taking people and putting them on low complex carbohydrate diets. You know, things that were pretty much minimizing to eliminating sugar and wheat and bleached flour and things like that. And you know what, when you really think about this, and out of all the studying that I've done in health, which is very extensive for anybody that's ever seen my office and see how many books I have since I've been doing this, you know what, the majority of the health problems that we suffer today, and whether I want to call them lifestyle diseases or whatever we seem to make them up, they all seem to be pretty much very conclusively directed towards the fact that we have this standard American diet that's very high in complex carbs and sugar and just empty BS calories, that's for sure. You know, and when anybody drops these BS calories or dramatically decreases these complex carbs and sugars and wheat and stuff like that, they notice a surge in energy, a reduction in these symptoms like pain and so many other things, whether it be they reduce inflammation, they reduce phlegm when it comes to asthma, things like that. So you can definitely do your own research, but you're going to see the correlation between complex carbs and diseases, whether it be autoimmune, arthritis, cancer, any of these things. They all seem to go hand in hand. And I'm sure you can take that, you can put that into so many different contexts, whether it makes our bodies more acidic or whatever you look at it. But the bottom line is complex carbs and the diet that we currently take in is definitely going against our healing. You know, So for anybody that's on using these protocols with lower carbs, you know what, lower complex carbs, sugars, wheat, you know what, I would say stick to them. You know, you want to have the odd treat and have the odd bite of some sugar and some wheat. But in the long run, you know what, it'll do nothing but kick you in the ass and make you unhealthy. And if you want to be normal, like society's normal, where everybody seems to be sick, fat, obese, you know, everybody seems to be getting an autoimmune disease, kids born with diseases. You know, if you want to be normal, jump in with that crowd, man. But I definitely know I don't want to be there. I made a lot of bad mistakes, and I'm, you know, trying to pretty much go against all the stuff that I've done now. But I'm telling you straight up, guys. You know, so you think about it, in third world countries, they don't suffer from the lifestyle diseases that we suffer from. They don't suffer from massive amounts of cancer, arthritis, diabetes, you name it. You know, they don't suffer from this. They may suffer from malnutrition diseases because they don't have a lot of food and good quality food because of a lot of political reasons in their regions, but they don't suffer from lifestyle diseases. And I'm going to tell you, it doesn't take a rocket scientist to be blunt enough to say, you know what, enough bullshit. You know, we're supposed to be one of the best countries in the world to live in, whether you're Canada, United States, England, wherever you're talking about, the developed countries in the world. We're some of the sickest nations in the world, and you know what? It's definitely because of our diet. Anybody that says it's not, do some research.
What am I doing? What am I doing? Oh yeah, that's right, I'm doing me. I'm doing me. I'm living life right now, man. And this what I'ma do till it's over. Till it's over. But it's far from over.